Ready? Get your wiggles out because we're go. Ready?
3, 2, 1.
I was diagnosed with epilepsy almost 20 years ago.
When James was 2.5, he started having seizures.
I had uncontrolled seizures for as long as I can remember now.
I thought that living with seizures was my new normal, but it doesn't have to be.
Everyone who has epilepsy owes it to themselves to have at least a single evaluation at an epilepsy center.
You want to go where the doctors are experts, and this is where you need to be.
It's really important for people with epilepsy to aim for 0, and that means no seizures, no side effects. So the only way to achieve that really is by going to an epilepsy center.
There are doctors that can help you more than any other doctor that you've ever seen before, and that's why you need to go to an epilepsy center.
With the correct diagnosis, the best medical management, and potentially surgical management, it is very, very often a curable disease.
It changed my life, it can change yours.
The journey through an epilepsy center begins with a simple doctor's visit.
We take a lot of time to listen to the patient. They tell us about their seizure.
Because that's how we learn exactly what the seizures are, where they might be coming from in the brain, and also what to do about it.
We work as a multidisciplinary team. Every team member is important. It's a nurse practitioner, a nurse, the EEG technologist, a social worker, education coordinator, neuropsychologist, dietitians, neurosurgeons. So it's very much a team approach.
The great thing is they're all talking to each other, so everybody knows James.
The doctors here let me into the team.
Everybody in the center comes together to discuss an individual patient, to go through every single detail and make sure that the recommendations we make afterwards is the best we can do for that patient.
And that means taking care of the whole person. Depression, anxiety, which is common in people with epilepsy, or educational concerns, and also the way that it affects the family around them besides the person who has epilepsy.
The EMU stands for Epilepsy Monitoring Unit. It is a place where patients come to get a video EEG recording, which is a video electroencephalographic recording.
EEG wires are attached to the head and monitors the ongoing EEG brainwaves. And there are video cameras all around that record when the patient has a seizure. And the purpose is to wait for the patient to have a seizure. And this is captured on the video and the EEG, and then the doctors can determine exactly where the seizures are coming from and what to do about it.
We keep them as safe as possible. Their bed is padded. They're on heart rate monitors. We have respiratory monitors. There's someone watching them 24/7 right outside their room who runs in the moment they have a seizure. And then they have an IV so we can give them abortive therapy if they need it. While they're having the seizure, we do a lot of clinical testing.
It allows us to identify what kind of seizure it is, where the seizure may be coming from.
And with that information, make the best plan for them, whether it be surgical options, dietary options, precision medicine with neurogenetic type options, or immunotherapy. Some patients don't have bystanders or anyone who's ever witnessed any of their seizures, and so they themselves might not know what they look like.
We don't show seizures to everybody. We obviously ask the patient, but I think for many patients it is actually an important experience to realize what happens to them when they have a seizure.
After the final test, they said, this is exactly where your seizures are starting. That result was the best feeling of my life, that somebody could actually tell me what was happening.
The National Association of Epilepsy Centers accredits epilepsy centers based on a number of criteria, and many of those criteria are centered around safety.
The organization itself is really designed to create epilepsy centers that meet the standard of excellence.
They have identified centers that have been certified. They know that they have good care, appropriate testing facilities.
So I like to think of the NAEC as the seal of approval for quality care in epilepsy.
We came here and we got the best care for him. The nurses and the doctors were just incredible.
Epilepsy can be controlled in about 2/3 of patients with medications. And in the others, you can make significant impact with advanced technology, what epilepsy centers can offer.
I never imagined that I would be able to be better. I feel more free than I ever thought that I could.
It's a unique opportunity for something you had for several years, and all of a sudden there's really a realistic chance to be cured.
James has been seizure-free for 4 years. Do you love it here?
Yeah, I love it.
It's wonderful to be able to change a child's life. That's what we strive for.
I want to make sure that everybody knows what a difference it makes coming to a center.
Working with them, finding that answer, and then sometimes curing them of that ailment and seeing how that has just changed their life. I mean, there's nothing more rewarding than that. It's a great feeling.